My name is Annette, I'm 63 and I live in East Devon. I was 53 at diagnosis. I'd had a mixture of symptoms from fatigue, which was quite extreme, from coming home from work and sleeping for 12 hours, to being very breathless and struggling with going to work. I thought my symptoms were around me being unfit, my age. I was advised by my GP to lose weight because I'd put on a stone in weight for no reason. Never even considered that it might be heart failure. My heart failure symptoms went on for 2.5 years. It was extremely frustrating. Lots of excuses of reasons why I was feeling that way, from just fatigue to whether I had had asthma, a variety of different ideas from the GP. None of them ever pointed towards heart failure. My GP did lots of blood tests, mostly for looking for inflammation, for arthritis, for asthma, but never heart failure was ever mentioned. My diagnosis took 2 years and 8 months from the time I first went to my GP to complain that I was short of breath. Diagnosis came after an echocardiogram, during which the person that did the testing said, "You have a severe heart problem. I'm going to ring your GP now." And within an hour I saw a cardiologist. My symptoms at that time were not being able to walk more than 5 or 6 steps without being in pain, being breathless, severe insomnia. I was only sleeping about 2 hours a night because I couldn't lie flat. Extreme fatigue. If I wasn't at work, I was asleep. Very much, yes. I had 2.5 years of severe worry, which was very frustrating because you keep going back to the doctor with the same symptoms. Symptoms are getting worse, and still at about 18 months they told me I had asthma, but I knew myself it wasn't asthma. I didn't know about the blood test for heart failure at all, no. And had I known, I would have mentioned it to my GP, but honestly thought that my GP was being thorough enough. Very much that the delay in the diagnosis caused me to be unreliable at work, which I hadn't been previously, and also to lose my independence. Whereas previously I was cycling 10 miles a day, now I was having to rely on other people to pick me up for work. For my family, it was extremely frustrating. I had grandchildren I couldn't pick up. Yes, very upsetting for everyone at that time. Waiting for diagnosis, I had to start sleeping downstairs. I couldn't get upstairs at night because I was so tired. Having to rely on other people, and eventually having to give up work. It would be that doctors would share their patients' symptoms, that there would be some platform of sharing that, discussing a patient that's repeatedly gone back to the doctor and is still not improving. I do feel that there should be a point at which the doctor says, "I'm out of my depth, I need to move you on to someone else." Yes, certainly I could have influenced my diagnosis had I been aware. I would definitely have spoken to my GP about other reasons for these symptoms I had.